Hi, I'm Emily Kennedy, health coach and fertility educator at Reply OBGYN and Fertility. One of our You Ask, We Reply submissions recently asked, how much folate should I take in preparation for pregnancy? And what are some important nutrients in a prenatal vitamin anyways? So, in many cases, food is definitely favored over supplements as your source of vitamins and minerals. However, prenatal vitamins are recommended because your needs of these nutrients increase during pregnancy. And some of them are difficult to obtain in the diet because of appetite changes, nausea, just different changes that are often typical when you're pregnant. Your needs are increasing. So let's discuss some of the specific nutrients. The first one is folate. This is a group of B vitamins that are important for brain and spinal cord development. And it's very important to consume this vitamin regularly because it doesn't store up in your body. Ideally, you should begin supplementing with some form of folate at least 3 months before trying to conceive. The general recommendation for supplementation when trying to conceive or when pregnant is at least 400 micrograms of folic acid or 600 micrograms of folate. Delicious food sources of folate include things like kidney beans, black-eyed peas, or even just your generic green peas, asparagus, which is in season right now, avocado, and of course, your leafy green vegetables. The next important pregnancy nutrient is iron. This is a blood-building nutrient, and your levels can actually be tested with a blood test if you like. The general recommendation for pregnant women is 30 milligrams a day, and you can get that from iron-rich foods, including red meat, seeds, nuts, cooked leafy greens, and beans. Also on the list for prenatal supplementation is calcium, one of the most abundant minerals in our body. This is a bone-building nutrient, as you probably know, and it's generally recommended to get 1,000 milligrams per day before pregnancy and to add 300 milligrams per day once you're pregnant. Some food sources of calcium, of course, include dairy, but if you don't have dairy, you can also get it from non-food sources like small fish with bones. My favorite is sardines, sesame seeds or tahini, which is sesame seed butter, almonds and almond butter, and cannellini beans. Another important prenatal vitamin is vitamin D. And this is important for the growth of the placenta and fetal growth, as well as for your immune system. Our Reply clinicians generally recommend 1,000 to 2,000 international units or IUs per day. But actually, the best sources of vitamin D don't come from food. It comes from exposing your skin to sunlight. Your skin actually makes it when you get outside and just get some rays. If you want to rely on food sources, you're probably not going to be getting enough, but they're still found in seafoods, egg yolks, walnuts, and fortified foods like milk. And finally, the last important prenatal nutrient is your omega-3 fatty acids, which include DHA and EPA. And these two fatty acids are important for brain and cellular health, kind of like your folates. So in the US, we tend to have a lower fatty fish consumption than the rest of the world. So consumption of about 8 ounces of fatty fish weekly is recommended to get the recommendation for DHA omega-3 fatty acid. The recommendation is 200 to 300 milligrams prenatally as well as during pregnancy. So if you're not a fan of fatty fish, which a lot of people are not, and you pick up a supplement of omega-3 fatty acids, do turn it around and look at the label, which will give you the breakdown of how much DHA and EPA is in it. So for example, this product I have here has 360 milligrams of DHA and 240 milligrams of EPA. But the grand total, which is the only information given to you on the front of the bottle, is 750 omega-3s. So you want to make sure that you're covered for 200 to 300 milligrams of DHA prior to pregnancy and during pregnancy. But let's back it up a little bit. Why take prenatal vitamins anyways? Well, supplementing prenatally actually ensures that you have an adequate intake of all these nutrients. And that's why they're recommended when you're trying to conceive or you're pregnant. But this is key. You've got to remember that your personal nutrient needs are based on your individual health history. So it's very important to discuss your prenatal vitamin needs with your Reply clinician. Me, as a health coach, I help you to make the actionable changes to meet the goals that you're probably already aware that you have. If you have any questions about health coaching, please give us a call at 919-230-2100 to find out if health coaching is a good fit for you. You can also reach us through the Reply Patient Portal or the Reply Health app on iPhone. And I encourage you to continue submitting your questions. Visit youaskwereply.com to learn more. Thanks for tuning in. Bye for now.